Have you noticed that something has quietly shifted? That the desire you once felt has become muted? Not gone entirely, just less. Less spontaneous, less frequent. And maybe you've wondered whether something is wrong with you. Here's the truth. Libido, sexual desire, is not a fixed number. It is not a personality trait. It is a biological signal influenced by dozens of factors happening inside your body right now. Hormones, sleep, stress, medications, relationships, mental health, even what you ate this week. Low sexual desire is one of the most common health concerns in the world. Studies show that nearly 1 in 3 women and 1 in 5 men report experiencing it at some point in their lives. And yet it remains one of the least discussed because people feel shame, confusion, or simply don't know where to start. That changes today. In this video, we are going to walk through exactly why libido changes, the science behind it, broken down clearly, and what the evidence actually says about what you can do. Whether this is something you're experiencing yourself or someone you care about, this video is for you. Let's begin. Before we talk about why libido changes, we need to understand what it is. Libido is the term we use to describe sexual desire, the motivation or drive towards sexual activity or intimacy. It comes from Latin meaning desire or energy. But here's what most people don't realize. There is no universal, normal level of libido. Sexual desire exists on a spectrum. It varies from person to person, from relationship to relationship, and across different phases of life. Researchers recognize 2 distinct types of desire. Spontaneous desire, when arousal arises on its own without any external trigger. This is more commonly experienced by men and younger individuals. Responsive desire, when arousal develops in response to intimacy, context, or stimulation. This is more commonly experienced by women and is equally healthy and normal. The problem begins when your own desire drops significantly from your personal baseline, or when it causes distress. That's when it becomes a clinical concern, sometimes called hypoactive sexual desire disorder, or HSDD. Now, what causes this to happen? For men, the central hormone governing sexual desire is testosterone, produced primarily in the testes. Testosterone drives libido, energy, mood, and muscle function. Testosterone levels peak in a man's late teens and early 20s, and then begin a gradual natural decline of approximately 1 to 2% per year after age 30. By the time a man reaches his 50s or 60s, he may have significantly lower levels than he did at 25. When testosterone drops below the clinically significant threshold, a condition called hypogonadism, or colloquially low T, the effects on libido can be pronounced. Men may notice reduced interest in sex, fewer spontaneous erections, fatigue and low mood, difficulty concentrating. But testosterone is not the only player. Prolactin, a hormone produced in the pituitary gland, can also suppress libido when elevated, a condition called hyperprolactinemia, which can result from a small benign tumor called a prolactinoma. Additionally, thyroid dysfunction, both hypothyroidism and hyperthyroidism, directly affects sexual desire in men by disrupting metabolic and hormonal balance. The important message here is, if a man's libido has dropped noticeably, a simple blood test can identify whether a hormonal cause is responsible. This is treatable. For women, the hormonal picture is more complex and more dynamic. Estrogen plays a central role in female libido. It supports vaginal lubrication, sensitivity, and the overall physiological response to arousal. When estrogen declines, as it does naturally during perimenopause and menopause, many women report a noticeable reduction in desire, along with vaginal dryness that makes sexual activity uncomfortable. Progesterone, while essential for reproductive function, can also have a dampening effect on desire, particularly during the luteal phase of the menstrual cycle, the days after ovulation. This is entirely normal, but it explains why desire often fluctuates throughout the month. Testosterone in women, yes, women produce testosterone too in smaller amounts, plays a meaningful role in libido and arousal. Low testosterone in women is associated with reduced desire, fatigue, and diminished responsiveness. For women who have given birth, the postpartum period brings a dramatic hormonal shift. Prolactin surges during breastfeeding actively suppress estrogen and libido. This is not a disorder. It is biology, protecting a new mother's energy for her infant. But understanding it can reduce a great deal of anxiety and relationship strain. Similarly, hormonal contraceptives, particularly combined oral contraceptives, PCPs, can reduce libido in some women by elevating sex hormone binding globulin, HSBG, a protein that binds testosterone and makes less of it available to the body. If you've started